What was important to me in my life was that I became a credible physician, similar to what my father had done.
I knew I wanted to be a cardiologist, and I wanted to be a place with great mentors and great teachers.
Dr. John Mountain
is an icon amongst people in my era who trained here.
Early in my career, I met Dr. Stacy Rosen, and I consider her still a mentor, along with Dr. Merez, who I've met along the way. So when I matched for internal medicine, I was thrilled.
I interviewed here, and I went home that night and told my wife, that's the place I want to be.
I'm a New Yorker. I'm from Queens. My family lives on Long Island.
I want to stay close to my wife and family.
There was a mission. We all had the same mission in mind.
Although we worked very hard, we enjoyed it very much.
A lot of good feelings in medicine after a lot of years. There's something called a trifecta. That's when you operate on a grandfather, a father, and a son. So you got to operate on 3 generations of people. And I got about 4 or 5 of those in practice.
We are summoned to act in wisdom and in conscience, to weigh our every deed with care and with compassion.
It was a very small, very intimate hospital. It was not a university hospital those days, it was a community hospital.
But it turned out to be much more than that. Even at the beginning, the quality that you saw was different.
The way we were treating patients at North Shore was head and shoulders better than what I had trained on.
To serve the community and advance the care.
When something developed, they've always been at the forefront of bringing it to the hospital.
Patients will call me in advance before even they call up to make an appointment to say, do you admit to North Shore Hospital? Are you on staff at North Shore Hospital? If I say yes, they'll come.
Medicine is much more technologically advanced now.
Already we're seeing surgeries and programs that we never thought we would see. Liver transplant, cardiac transplant, islet cell transplants, things that we didn't even dream about 20 years ago.
Look at the slope of advances in this hospital. I think it's going to the stratosphere.
We are building a new annex to our operating room suite, a building that is going to be state-of-the-art.
But the fundamental relationship is still what really makes a difference in terms of patient care, and I think in patient outcomes.
Go first there. We'll definitely have to assess that.
The major reason for the growth of North Shore University Hospital has been the partnership that we have with our community physicians.
I've had great relationship with the community oncologists. Ruby Sharma and Laura Weisselberg.
Dr. Joe Epstein and Dr. Robert Karras. It's been my great pleasure and benefit to have a really good relationship with the neurosurgeons over the years.
Dr. Abrar Hussain, he trusts our kidney transplant centers, with his patients.
I don't ever hesitate to call on anybody who works full-time at Northwell.
I can call Dr. David Shelev, send him, here is the patient's note, here's the patient's phone number. Please call them, get the patient in, he'll get the patient in, done. Patient gets excellent care.
There have been doctors who were in private practice in the community that I've worked with right from the get-go. Dr. Heimovich is an example of one of those. We believed in each other's judgment, our clinical skills, when to act, when to not act, and we both felt that we were the kind of doctors that each of us wanted to see in another physician.
North Shore Hospital is not just the place where I trained and where I work, it's also the place that, I'm gonna choke up.
I look throughout the years as how has it been going. Did I hook my wagon onto the right horse? And North Shore has just been amazing in terms of its explosive growth.
and really on the pulse of medicine. And, you know, within the Northwell system, you feel like you're part of something that's, you know, growing and greater.
The clinical opportunities, the resident training opportunities, the research opportunities, the academic opportunities are really profound.
Hi guys. I see this as being a mecca for the metropolitan area for both clinical and academic medicine.
We're going to continue to serve the rest of Northwell by being able to manage everything that anyone can imagine.
You know, came a long way. No question about it.
I have a very warm place in my heart for this hospital, not just because it's where I grew up and work, but also because they've taken such good care of my family over the years.
This place would not be what it is today if it wasn't for our community physician referring patients to us, coming to see their patient, trusting us, this hospital, with the care of their patients and their family members and their friends.